Okay, hi everyone. My name is Omar. I'm a third-year medical student at the University of Calgary. I'm really excited today to be joined with Dr. Andrew Brown, who's an vascular and interventional radiologist at St. Michael's Hospital with the University of Toronto. Dr. Brown has so kindly agreed to share his career journey with us today and answer some questions that medical students have just about the field of radiology. So this video is part of an ongoing series produced by the Medical Student Network with the Canadian Association of Radiologists. And the series really aims to understand the field of radiology just a little bit more for medical students and interview radiologists from a variety of different backgrounds. So let's jump in. So thanks again for being here, Dr. Brown. My first question was, tell me more about why you chose a career in radiology, and did you explore any other careers in medicine?
For sure. I knew that I always wanted to work with my hands, like
Mhm.
surgical subspecialties sort of really spoke to me.
Yeah.
Um, but it wasn't until my anatomy lab that we were doing this dissection of the bisected head. And I don't know if you've ever been in an anatomy lab with a
Yeah,
bisected head. It's kind of wild.
definitely.
And
Yeah.
I was thinking to myself, do I want to be doing this? And so at the time we had our anatomist, our anatomy lab professor was Ian Taylor, who's sort of like a big guy who used to be at the University of Toronto.
Mhm.
And I went to him and I asked him, I'm like, I'm interested in surgery, but this bisected skull stuff and this stuff
Yeah.
seems aggressive. Like I don't know if I want to be a surgeon.
Yeah.
Uh, and he said, all of medicine's not like that. Like don't let that put you off.
Uh-huh.
But there is this thing called interventional radiology. If you're interested in image guidance or minimally invasive procedures, there
Mhm.
are other options for folks who want to use their hands. And so that's sort of how I actually really got introduced to interventional radiology as a specialty.
Mhm.
And then it wasn't until sort of the span between my second and third year of medical school that I actually did an elective at Sunnybrook in interventional radiology. And it was sort of like a light bulb went off in my head, and I was like, wow, this is incredible. The things that we can do with just some x-rays or just with ultrasound
Mhm.
was incredible to me. Whereas, in some of the other surgical subspecialties, to treat patients, you have to do laparotomies, they're morbid procedures, folks are in the hospital for a long time.
Mhm.
Whereas in interventional radiology, folks go home the same day, right? And so for me, that really spoke to me for a number of reasons. One, just, being able to do something minimally invasive was really cool. But
Mhm.
as we'll probably talk about later, like I have an interest in how hospitals function and efficiency. And so when you think about what are expensive, challenging resources in hospitals, hospital beds obviously paramount among those.
Mhm.
And so being able to provide care for patients and have them go home that same day really was interesting to me. I explored some other things.
Mhm.
Um, One of the things I thought I would like was ophthalmology, but then I couldn't get around eyeballs.
That's fair. Yeah.
As like most medical students, you explore a bunch of different things, but
Mhm.
I was really excited by interventional radiology.
That's exciting. That's awesome. So my next question was a little bit more on kind of just like the training programs within Canada. So, we've seen in the States kind of interventional radiology residency programs kind of branch off from diagnostic radiology, as medical students kind of go through the match. So I was curious if you could talk a little bit more about the plans for future IR residencies in Canada, specifically for medical students.
For sure.
Yeah.
And I know, just talking to medical students, there's a lot of, I guess, misinformation or
Yeah.
disinformation out there around what IR residency is going to look like. Sorry,
Hmm.
what IR residency is going to look like.
Hmm.
Um, and for the most part, as it stands right now, it will be very similar to the current pathway. So I'll take a step back and describe what happens now.
Yeah, of
And
course.
so if you want to be an interventional radiologist, you do 5 years of a diagnostic radiology program,
Hmm.
and then you do an additional year, which is referred to as your fellowship. And so it's 6 years of training.
Hmm.
We're in the current process of transitioning to an IR residency, and there are 5 IR residency programs across the country, University of Toronto being one of them.
Hmm.
And the way that the residency program will work, it will be structured very similar to the current fellowship program in that you would do 5 years of diagnostics with an additional year of residency training. So you'd be a PGY6 in interventional radiology.
Hmm.
And so why a PGY6 year? One of the things that it allows you to do is you get treated like a resident. And so you're still covered by payroll. And the ways in which you're evaluated sort of carry through from residency into your PGY 6 years. So it provides sort of a more fluid um, training experience, one that has sort of the same requirements and rigor as a normal residency program.
Gotcha.
At the end of the 6th year, you also are able to write an exam, just like other subspecialty training programs in interventional radiology. And so that gives you sort of that other level of certification that says that you've trained in an accredited training program and are a well-trained interventional radiologist.
Gotcha.
Each of the programs is doing in terms of the way it's delivered is a little bit different. And one of the things that I hope to do at the University of Toronto is to ensure that there is some training in the PGY5 year that overlaps.
Hmm.
And so, my hope would be able to produce a training program that in practice is really sort of 18 months in duration. And so that's how we're trying to give students more IR training than the typical 5+1 that most folks are used to in the old fellowship model. And so there's different ways that we're working to play around with this to give a greater training experience. Now, obviously, in the US, it's a bit different. They have direct entry programs, and there
Hmm.
are no direct entry programs yet in Canada. But certainly, from my perspective, and I think from a lot of other folks, that's would be a good direction to move.
Hmm.
But these things sort of take time to develop these types of training programs, and so my hope would be, you know, within I don't want to give a particular time frame because there's a Royal College and there's a lot of
Yeah.
moving pieces, but
Hmm.
if we could see in short order in the next 5 to 10 years have direct entry programs similar to things like vascular surgery, that would be extraordinary. And I think would give folks a really robust training experience. Because as you get into interventional radiology, you begin to see sort of the breadth of it, right?
Hmm.
We do everything from interventional oncology to peripheral vascular work. And so from that perspective, there's a lot to learn. And most folks that I speak to when they finish their fellowship, they feel like they've just sort of, they just it's like the tip of the iceberg.
Mm,
And
gotcha.
so from that perspective, I think a longer training course would make sense, but perhaps not even longer, but one that's more tailored towards IR than the current sort of paradigm.
Cool. That's awesome. That sounds exciting. So lots of different changes coming in the future.
Absolutely.
Um, I was curious if you could talk a little bit more about your role as program director now for an interventional radiology residency program, and kind of how do you envision your role kind of changing or adapting in the future?
Yeah. I think for many of us, what's going on right now is we're in the process of understanding how competency by design will impact the IR residency programs.
Hmm.
And so what we do is we actually meet with the IR residency program directors and with folks from the Royal College to kind of spell out what our program should provide and the types of training experiences that students would need to be, good interventional radiologists at the end of the day. And so right now my role is centered primarily around that, trying to understand what the program should look like. As the programs evolve, I think part of it's going to be a bit more around, how do we evaluate these programs? How do we make sure that we're providing a robust training experience? And then what are the next steps in terms of how do we prepare graduates for the the new things coming down the pipeline as it relates to IR?
Hmm.
Because that's what I find is actually quite exciting about IR as a specialty. It's always changing and growing, and there are new disease processes that we tackle, and there's sort of new ways of doing things. And so understanding how we can prepare uh, the residents for what will likely be an uncertain future in IR, and not in a bad way, but
Hmm.
there's going to be technologies and techniques that I haven't used before. How do you create a training program that keeps that in mind and helps prepare the folks that go through the program so that they can then go ahead and you'll be master some of this new technology or these new approaches. And so as the training program grows, I think that's going to be an important part of the role. And then finally, sort of just thinking ahead around how we can create an experience that, as I said, take some of the lessons learned from other training programs that went from a fellowship model to a direct entry model, like folks like in vascular surgery. I think will really be important as sort of this specialty grows. As I mentioned, right now there's only 5 training programs, right? But what does that look like when we start doing direct entry? What does that look like when every medical school in the country need an IR program? What happens when that happens?
Hmm.
Those type of things I think are actually really exciting and are going to be top of mind as these programs grow.
Sounds great. Yeah, no, definitely sounds exciting. My next question was a little bit more kind of along what advice you had for medical trainees specifically interested in either a career in diagnostic or interventional radiology.
For sure.
Yeah.
I think as it relates to diagnostic radiology, and I think this is true of any specialty, you really want to spend time in it and try to get a feel for, is this for me? Because, you know, you may think that radiology is what you want to do, but then you start a rotation and you say, well, I don't like radiology. If you can do as much of that exploration early on as possible, I think that would stand you in good stead because it becomes a bit more challenging once you get later on in the game because once you've committed to a specialty, sometimes it can be hard to switch path
Mhm.
because, as you're probably aware, you're kind of many people may question your motivations if they may think, oh, maybe you're just applying to radiology or another specialty as a backup, right? Maybe they're not truly invested in this specialty.
Mhm.
And so the more that you can do that exploration up front, in your like first and second year, the better, so that, as you get further along in medical school, you can really commit yourself to a specialty and set yourself apart from your colleagues when you do apply to the residency program that you want. As it relates to IR specifically,
Mhm.
IR is a bit challenging because, as I mentioned, IR is something that you would do ultimately in your PGY 6 year or your fellowship year. And
Mhm.
so it may be some time before you actually get to do a bit more IR. But
Mhm.
when you think about what IR requires, um, it really is like a mindset as well as a skill set, right? And there's actually a really great book called Skill that I recommend to a lot of medical students and residents. And it's actually written by an orthopedic surgeon, and it talks about how to master surgery. Um, but it doesn't have to be surgery. It can be playing an instrument or a sport. And what he talks about are various mindsets and the ways in which you approach problems and the ways in which you try to improve on a daily basis how you perform at specific tasks, right?
Mhm.
And I think that's actually really tangible, and that's something that would, I think, really help residents as they sort of make their transition into um, a program like interventional radiology. Because again, as I said, there's a lot to learn in a very short period of time to do it in. And if you have an approach to how you're going to learn, how you're going to improve, I think that you'll do much better. And so even as medical students, I recommend it to medical students because again, the more you have practice at developing these habits, I think the better you'll be. And ultimately, it's not we're talking about residency and fellowships and
Yeah.
training programs and things like that. But these are skills that you can take into other areas of your life as well. And so it's something that I think if you're thoughtful, is a good use of your time.
Sounds great. No, definitely. Sounds great. My next question was curious. I was just wondering if you could talk a little bit more about kind of some of your background before you entered medicine was your MBA, your Master's of Business Administration, and kind of what skills you learned from your MBA and how do you kind of use in your career in medicine today?
For sure. I mean, there's a lot that I can talk about that experience, and so,
Yeah.
um, ultimately, I did what most medical students do is I went to Mac for undergrad, then
Nice.
after Mac, I went to U of T for medical school,
Mhm.
and then I got into residency at U of T for diagnostic imaging.
Mhm.
Um, but I always knew that I had an interest sort of beyond medicine,
Mhm.
and part of that was a function of the fact that I had a sense that as physicians and as folks in healthcare, we spend a lot of time thinking about how drugs work, and we spend a lot of time thinking about how to treat disease, and I think that's important. But one of the things that doesn't get as much attention is, how the intersection of medicine and management, right? How do we get the patients into the room so that we can deliver the therapy,
Mhm.
right? And I think we don't get a lot of good training around that. So, speaking with some of my mentors, I made a decision to pursue an MBA, and so I did that at MIT after my PGY 2 year.
Mhm.
And so there was a deliberate strategy around that because there are some programs and some folks decide to do their MBA or whatever advanced training before they start residency, or
Mhm.
some folks choose to do it afterwards. I thought that doing it during my residency was a good strategy because I had had some experience in the hospital. I did my first year of residency, which is a rotating internship. I had
Mhm.
done 1 year of radiology, so I kind of understood how the hospital worked and how radiology works.
Mhm.
And so I felt that that sort of gave me at least a foundation as I went into my MBA. And I also decided to do it early on in residency because obviously you have exams to write at the end of residency, right? And so I decided to take 2 years off. And so I left residency basically for 2 years to do this and move to America.
Mhm.
Um, and so during that experience, I wasn't doing a whole lot of medicine. And so, to do that in your PGY 4 year and have to come back and write the exams would probably be pretty challenging.
Yeah.
And so that's sort of why I chose to do it early in my residency. And I learned a tremendous amount. I chose to do a general purpose MBA. And so what that means is that, it wasn't specifically healthcare, but I took a lot of healthcare classes and I shaped it into a healthcare experience. But I was very deliberate. Like I didn't want, there are some advanced MBA programs that are for doctors and you do a year and then you pop out of your training scheme and you come back. But I actually wanted to be immersed in sort of a 2 year experience
Mhm.
in general management because it gave me an opportunity to see how other industries function, how other parts of the world function. And what I hope to do and what I've been doing in my research is trying to bring that back to, the work that we do here. And so when you ask, how do I use that today?
Mhm.
Not only is it obviously helpful when working with people and working with teams, right? Like in IR, it's not just me, it's me, the nurse, the technologists, and there's a whole group of us who perform these procedures and make the magic happen. And so
Yeah.
that it's obviously helpful in that regard. Um, but it's also helpful because some of the research that I do is centered around how do we make healthcare more efficient and how do we improve the quality of care that patients receive. And so obviously I went to a very technical school, MIT, and
Yeah.
so we did a lot of work around machine learning and understanding how technology can be brought to bear to solve some of these problems. And so much of my research focuses on things like natural language processing, um, computer vision, using new technologies to basically help reduce errors in healthcare. And so that's how I've been able to use my MBA. And I really do think, I still think to this day that it was the best educational experience I've had in my life. Um, but I would encourage other folks that are thinking about choosing a path, whether it be an MBA or any other type of advanced degree during the course of their training, to really understand what they want to get out of the experience. Because, to go there and not have a game plan, I think it's sort of a missed opportunity. Um, because there's so much that you can get out of experiences like this, but
Mhm.
it becomes difficult if you don't have a plan and you're just sort of listless and you're just sort of going with the flow. I really knew that I wanted to bring technology and an approach to technology back with me to Canada and bring that to bear on some of these problems. And so that was sort of my game plan. And so I spent a lot of time with startups. I spent a lot of time at this place called the Media Lab, which does a lot of really interesting and innovative research around technology. And
Mhm.
so I had a plan. And so if you're thinking about doing something similar, as a medical student or a resident, I'd really encourage you to talk with other folks that have been there, speak with folks, who have done other similar things, find mentors, and develop a game plan because I think that will really help you get the most out of the experience.
That's awesome. No, sounds great. It sounds like it was a really valuable experience for sure.
Oh, I love it. Best academic experience of my life.
Awesome. My next question was a little bit more related as well. So, in terms of pursuing either an MBA or a master's, or maybe even a PhD, kind of within your medical training, could this additional training maybe change your job prospects as a future radiologist?
For sure. And so I think it depends on what you want to do. And in my mind, I think about the distinction, and probably the most significant distinction I would say is probably academic versus community, right?
Mhm.
If
Yeah.
you want to do academic medicine, that is, you want to do research, you want to teach those type of things, an advanced degree really helps you because an advanced degree is important for things like tenure and making your way through the professorial ranks and things
Mhm.
like that. And so that's actually important for promotion. And so having an advanced degree certainly helps with that. And obviously, if you've done some research before, you know something about research, it probably makes your research more effective in an academic community, right?
Definitely. Yeah.
Um, if you're in the community, it's probably less important, but still not unimportant because, if you wanted to take on a leadership position in the community center, there is opportunities for that. And again, one way to distinguish yourself is to have those types of credentials, like doing an MBA. And
Mhm.
that will actually give you the skills necessary to hopefully manage a department or manage lead projects and things like that and really be a resource to the hospital. And so that would be important. But also remember what we're talking about is we've talked a lot about like academic medicine. I'm a radiologist. I work at a hospital, but there
Mhm.
are other things as well, right? There's a lot of folks who work in independent healthcare facilities, right? These are places where you can start your own business kind of as an entrepreneur, um, reading imaging, producing imaging, right? That's another avenue that one could pursue. And there are other things, right? As I mentioned before, startups and other organizations that are interested in doing innovative work. Then that might be for large corporations, or that may be for small startups, right? And so there's a lot of opportunities to sort of use those skills in that capacity. And then there's things like obviously like working in government, working for the ministry.
Mhm.
Um, Obviously, they need physicians to help them understand what are some of the pain points and problems in healthcare and develop new solutions. And so that's all often an important pathway as well. So
Mhm.
there's a lot of different ways in which you could use that type of advanced training, and not only just sort of in the medical context, you could do stuff that's outside of medicine and find ways to solve important problems with those skills that are maybe medicine adjacent or adjacent to radiology, but
Mhm.
still give you an opportunity to flex those muscles. And I think that's actually really important to think about as trainees. While you spend all your time in the hospital, you're in medical school all day, every day.
Yeah.
Um, there's more to healthcare
Mhm.
than just that sort of slice of the profession, right? And there are many ways in which you can get involved um, and really make a difference.
Mhm. No, definitely. Sounds great. And then I guess kind of the last question we had, a little bit more of a fun one to kind of end things off, was where do you kind of see radiology heading within the next 10 years?
It's really interesting. When I came back from MIT, that was in 2015, um, and I had done all this work around machine learning and artificial intelligence, and had, been to all these classes and lectures and ran experiments and published stuff.
Yeah.
And it was really interesting because when I came back, it was like the sky was falling. Everyone was kind of
Yeah.
afraid of artificial intelligence, and to the point where people like Jeff Hinton, big names in artificial intelligence, were saying like radiology and radiologists are going to be no more, right?
Yeah.
They're going to be replaced by robots, and
Mhm.
that actually had implications for folks who applied to radiology, right? People were like medical students were like, radiology is not a specialty that I want to be in. It's going to be replaced by robots.
Mhm.
And we've kind of swung almost entirely now the other way.
Yeah.
And I could have probably foreseen this because as someone who does this research, it was very clear to me that yes, that the technology is impressive, but to replace radiologists tomorrow is not going to happen. Like that's not. There's regulatory risk. There's all sorts of um, challenges with the idea that you could just plop a computer down in front of a workstation and have it replace radiologists.
Yeah.
And so, I think that fear is gone. But where I think artificial intelligence and machine learning will really help is helping make physicians more efficient, right? There's technologies out there that help prioritize studies, right? It'll do like a pre-screen of all the CT heads and say, this one has a bleed, read this one first, right?
Mhm.
There's companies out there that are doing sort of like patient care workflow management, right? Where they'll say, okay, well, the CT scan shows this. The treatment for this is X or Y, and will page the appropriate people to make sure that those are the folks that get notified as soon as possible to help minimize the time that a patient has to wait in order to get their procedure or their surgery or what have you.
Mhm.
And so those are the ways in which I think AI is going to play an important role. And those are here today. There are companies that are offering those type of solutions today.
Yeah.
When I think about the next 5 to 10 years, I think there's going to be more and more of a push for these tools in IR as well. And so obviously IR is like a tactile specialty, right? You have to use wires and catheters and probes and things to perform a procedure. But I think that we're going to see more of these tools start to play a role in IR as well, and robotics will start to help us do our jobs better and more efficiently. And so that's where I think radiology is headed, is that we're going to be augmented by a lot of these tools. I don't think it will replace radiologists. There's been surveys of patients and the population, and they've asked, do you want like robot doctors? And most folks say, no, not yet, no, thank you.
Yeah.
And so, I think there's still ways to go before we're replaced. But I do think, coming down the pike really soon are going to be more and more AI-based tools to help us do our jobs better. And that I think is like an exciting part of the profession.
No, definitely. Yeah. Definitely exciting time to definitely be involved in radiology for sure.
Absolutely.
Sounds great. So thanks a ton, Dr. Brown. So I guess this brings us to the end of our interview. Is there anything else that you kind of want to mention before we head off?
Um, the thing that I often will tell medical students or residents is
Mhm.
with IR is a specialty that is a little bit different than DI, right? Like in DI, it's very much about being a diagnostician, interpreting images, and I think DI actually helps make you a better interventional radiologist. I think there is certainly important overlap. If you can read the images, interpret the images, I think you'll be better able to do your job as an interventionalist. As an interventionalist, I think the challenge sometimes has been is that as radiologists we're not really seen as clinicians, right?
Mhm.
um, and I think that is certainly changing, particularly for the younger folks who are coming through the profession. I chat with patients and see patients in clinic. I round on patients that we've done procedures on.
Mhm.
That is really what it means to like actually provide robust care for patients, right?
Yeah.
um, and I think as folks that are coming into radiology with an interest in IR, I think that's sort of the mindset you have to have, particularly I think to be successful in the future of IR, because the IR is becoming much more of a clinical specialty, and with much more patient interaction, much more patient responsibility.
Mhm.
And so I think that's just something to sort of really keep in mind. And while you're on your rotations, I think it's important to sort of practice those skills, because gone are the days where interventional radiologists are like technicians, right? Like they're like the the Midas touch or whatever, where these guys come down, they do a procedure, and
Yeah,
then they send you
exactly.
back upstairs to the floor like that.
Yeah.
That I don't think is really the way IR should
Mhm.
be practiced, nor is it how it will be practiced in the future. And so, the more that you can use those types of rotations in your medical school, in your residency, to really develop those skills as a clinician, I think it will make you a better interventionalist.
No, definitely. Sounds great. Thanks a ton, Dr. Brown, again for the interview and for the wise words. It's been really great to just learn a little bit more about your career journey and kind of the exciting fields and changes to IR training in Canada, and the field of radiology, I think, in the future too. So take care, everyone. So
Absolutely.
hope you enjoyed this video on from the MSN, from the Canadian Association of Radiologists, and you can check out the website, and the YouTube pages for more videos and with other radiologists across Canada. Okay,
Thanks
take
for
care,
having
everyone.
me.
Take care. Thanks.